Welcome back. Today we're going to talk about shoulder pain. I get a lot of questions about shoulder pain because our shoulders are used all the time. Many times we have shoulder pain at night because we're not sure how to sleep and we sleep on our shoulder wrong or on our side wrong. But also we get it during the daytime just when we're using arm and reaching overhead. So many times we can get shoulder pain that comes across the shoulder, or even it goes a little bit higher into the neck area. Some people have pain on the front of their shoulder, and I even have people have pain in the back of their shoulder. So now when we think about shoulder pain, if we keep along the same theme as what I've been talking to you about, when we have pain, it is typically related to your position, and your position being off. So when you develop pain just spontaneously, and it hasn't been an injury like you fall on your shoulder or you're in a car accident, but if you think about pain that just shows up, then we want to think about what is it about our position that has changed overnight or even over the past several weeks that has allowed you to change the way the bones are hitting against each other and can lead to impingement or tissues pinching together, whether it's bone and muscle, bone and tendon, bone on bone. So we want to think about the position of what you're in. So a lot of times we have a forward shoulder posture, and if you look down at yourself, you can see one shoulder might be forward, but you can also look at yourself in the mirror and see your shoulders up. And you may be so used to holding your shoulders up that the muscles here have learned how to stay contracted and keep your shoulders elevated, that when you go to try to lower your shoulders, you can't because they're just high all the time. And it's going to take some practice and work on relaxation and changing your breathing in order to bring the shoulders down. Sometimes I'll see people who have their shoulders pulled back like this all the time and they're elevated pulled back, and they're so rigid because the muscles in their upper back here have been taught to keep contracted at all times, and so this is all they know. So then what that does is it brings the sternum forward, which takes that rib cage that I was teaching you about in previous sessions, and it puts it on a hinge, and then you're stuck in this posture because this is how you think you should be all the time, instead of letting that relax down and the shoulders drop into place. So I don't want you to be this slouched, but in neutral, so you're not like that. And if we think about shoulder pain as a problem because of our positioning, then we can start to learn how do we fix it. And that will come in some future episodes. But at first I wanted to give you some reasons why you can have shoulder pain, so you can start looking at yourself during the daytime when you're sitting at your desk, when you're doing some work. Pay attention and develop some awareness of how you position your shoulders throughout your daily activities. What do you do when you go to reach, when you reach overhead, when you lift something up? What do you do? And we'll address some of the things to look at in a future episode. Also consider, pay attention to how you go to sleep, and when you lay on your side, do you crunch up and curl up, or are you able to keep your shoulders down? And if you wake up in the night, what position are your shoulders? These are some good tips to think about and record for when we discuss more about shoulder pain. Thanks. Bye.